Hey guys, this video is going to be all about when you should go to the urgent care versus the emergency room. Right now, I am working at an urgent care. As an x-ray tech, I did my clinicals at hospitals and worked in the ER. And then now as a tech, I am working at an urgent care. There's a lot of people who come into the emergency room who could have best been served at an urgent care, and then there's people who come to the urgent care who we have to send to the hospital because their condition is too bad to be able to be seen. I feel like this is something that nobody ever taught me. Urgent cares can provide health care on a walk-in, no appointment basis for acute illness or injury that is not life or limb threatening and is either beyond the scope or availability of a typical primary care practice. Urgent cares are usually open 7 days a week with hours that extend beyond the standard physician office hours. And emergency rooms are places that you go if there's an actual emergency, if a person or unborn baby could die or be permanently disabled. You should definitely go to the emergency room. Some reasons you should go to the emergency room include difficulty breathing or shortness of breath, chest or upper abdominal pain or pressure. Chest pain could possibly mean that you have a heart attack. Fainting or sudden dizziness or weakness, sudden changes in vision, confusion or changes in mental status. Anytime you have something that might be wrong with your abdomen or pelvis, or a blood clot in your legs, or if you think you have a blood clot in your lungs. Anytime you're having anything with the brain, especially like a stroke, any sudden or severe pain, uncontrolled breathing, persistent or severe vomiting and diarrhea where you are very dehydrated. If you're coughing or vomiting blood, that could be a really serious issue. If you're having any suicidal or homicidal feelings, if you are diabetic and then your blood sugar is really crazy, lower than 60 or higher than 250. If you have bad burns, serious bad burns, where a lot of the skin is burned and you can get really dehydrated. If you got bit by a venomous animal or insect, especially with a rattlesnake, if you're having childbirth or vaginal bleeding, definitely go to the emergency room. Urgent cares are not emergency rooms. You should not treat an urgent care as an emergency room. Some reasons to go to an urgent care are for general illness treatment, like bronchitis, cough, congestion, fever, sore throat or runny nose, flu treatment and prevention, minor injuries and infections, abscess, incision, and drainage. And minor injuries, it has to be pretty superficial injuries because some people have been coming into the urgent care and their muscles are showing and something might be wrong with their, they slice their finger and it might be deep enough to slice a tendon or ligament. That needs to go to the emergency room because we can do stitches at an urgent care, but it's usually just external stitches, so stitches that they put in and then they can just remove it after a week or 10 days or something. But at a hospital, they have the other special stitches where they're more internal stitches that when you put them in, you don't take them out. They just dissolve into your body. If you need an x-ray, you can go to the urgent care. Urgent cares don't have fluoro or CT. It's usually just x-ray. And then for immunizations like tetanus or the flu shot, if you think you have an STD, you can go to the urgent care and then we can take some urine or take some blood or both and send it out for testing. There's a lot of people who come in for UTIs, so we can do in-house testing for that and then send it out to the lab as well. And then we also do COVID-19 testing. And it's really funny because some people come into the urgent care and they're like, oh, I feel so much safer here. It's not the hospital where they do COVID testing. And we're like, yeah, we do COVID testing too here. It's not as quick as like a drive-through COVID testing, but yeah, we do COVID testing, and some days we do more COVID testing than anything else. And then also we can do physicals, like DOT physicals, or physicals for school, or physicals for work. We can help with allergic reactions, allergies, asthma, rashes, itchy skin, athlete's foot, migraines, nausea, vomiting, gastrointestinal disorders, stomach aches, eye or ear problems. And we do ear lavages too. So hopefully that helps you guys understand a little. Please be wise. Time and money can definitely be saved, and your life can definitely be saved. Thank you. Thanks for watching.